Hi, it's Bex from Claudian Sports Therapy. So I wanted to just do a video just to explain a little bit about our bespoke orthotic assessments and what it involves. So we'd first start off with consultation. So we want to find out about your background, so a little bit of previous medical history. So if there's anything that might affect how we treat or what prescription we might put in, along with kind of any problem areas or symptoms that you're receiving. So we want to find out how things are being affected, whether it's stopping you walking to the shops or whether you're training for a marathon and keep getting injured. So we see both extremes and all in between. And also the demands of life, so our lifestyle, so could be occupation, family, sport, activities, anything like that. So there might be certain movements or certain things that you're struggling with, and it just helps us build up that picture to what's going on before we start into kind of our more kind of physical and movement type examinations. So from there we then move on into kind of quite a thorough assessment really. So we're looking at your posture and biomechanics to start off with. So we're not just looking at the feet, we're looking at kind of knees, hips, ankles, backs, pelvis, what's going on, whether there's any twisting going on. We want to find out where kind of the muscles and joints are being loaded up, and whether there's excess areas where there's lots of pressure going through which is causing you a problem. And take that pressure off, or it could be that some muscles are weak, so we want to try and add in some strengthening exercises for you to be doing as well to try and complement the orthotics. So within that we're doing kind of special injury and kind of muscle tests to make sure that we can find out exactly what is going on, and then looking at full body movement, so looking at your kind of gait walking cycle, so everything from where your heel hits the ground, rolling all the way through until you're coming off at the toes. So from there we'd also look at your footwear, so we ask you to bring your trainers and shoes and a couple of pairs with you, so we can have a look at the wear on the feet, on the shoes anyway, to actually find out whether there's kind of a regular pattern going on there as well. Some people tend to be more heel strikers and they get a lot of wear on the front. Some people tend to be more light on the feet and a bit more through the front. And again, it can vary left to right as well, and the left and right foot might be doing something different. So footwear is a really good way for us to have a look at what's going on when you're not being observed, because obviously when we're watching you we tend to correct ourselves a little bit more, so footwear gives us really good insight to what's actually going on as well when you're walking or using them day to day, which then kind of takes us through into our orthotic prescription. So all the orthotics are made especially for you and your feet and your footwear, so prescriptions can be different left to right, as well as changing them for the footwear. So we've done, quite often we do trainers, we'll do workwear, we do them for walking shoes, but then we've also done them for wellies, so we can do them for all sorts of shoes, not every shoe, but this is something that we would talk to you about as well during the appointment, so what types of shoes might be suitable, and which ones maybe aren't giving you enough support. So we then send the prescription off for manufacturing, so we usually get them back within 7 to 10 working days, at which point we can then get you booked back in to come in to see us for a fitting appointment. So within the fitting appointment we make sure that they fit and be comfortable, but also we want to double check those joints and muscles, again just checking that we've offloaded some of the stress from kind of areas which are kind of taking a lot of pressure, and making sure that everything's working as it should do. So we then can advise you of how to wear them, so starting to build them in so we don't end up with problems from jumping straight in with them. So we tend to build it up gradually because we need to give the body time to adjust to them. So within kind of the first 3 months as well, we're able to do a free readjustment. So if there are any problems that are starting to arise or they don't quite feel right, then the sooner we can get you back in, we'd rather make sure that they are right and they're comfortable and you're going to wear them to be able to get the full benefits. So to the assessment, we kind of, I've already said about bringing trainers or footwear with you. But we also ask if you bring a pair of shorts, so then we can have a look at what's going on with the legs when you're moving, as well as performing our kind of special tests. So hopefully that gives you a really good round kind of idea of what we go through when we do one of our bespoke orthotic assessments. If you've got any questions, then please do get in touch. So our website is www.clwyddiansportstherapy.co.uk, or you can also get in touch with us on 01352 746 500.